Hi, I am Dr. Parul Katiyar. I am a senior fertility specialist. Today, the times have changed and a lot of couples are now delaying to get pregnant or to start a family. The reasons can be many. The first and foremost, we have seen that there is a trend to get married later in life. Secondly, everyone has more priorities to look after, like finishing their education, looking after their career or financial stability, as well as increased exposure to environmental toxins. Therefore, today I will be talking about certain lifestyle modifications that we can do in our lives that will help us in maintaining a healthier life as well as improving the fertility. So what does lifestyle really means? It simply means that the way you live. It is a very wide term and there are many aspects to it. The most common aspect that can impact the fertility are the weight issues. What we've seen is a pandemic of obesity all over, and this can be because of a sedentary lifestyle, of bad dietary patterns as well. And whenever there is obesity, there is an excess of the fat cells in the body. This leads to the hormonal imbalance because it leads to an overproduction of estrogen hormone. It leads to insulin resistance in the body, which will affect the ability of a woman to ovulate regularly and also cause other hormonal issues. Similarly, for men, excess of female hormone in the body is definitely not good. Another important aspect in lifestyle is how much and how frequently do we exercise. It is important to remember that mild to moderate exercise is very important to remain healthy. However, we should not overdo it because excess of exercise has been linked to hormonal imbalance in women as well as leads to anovulation and irregular periods. Even men who are looking to build their bodies and pump their muscles sometimes overdo it and also take a lot of hormones so that they look pumped up. This hormone is actually testosterone, which is very harmful for a man's fertility if taken from outside. Therefore, even if you are trying to live a healthier lifestyle through exercise, just do it in moderation and do not be tempted to take all the supplements that are being given to you. One very simple way to improve our fertility is just by going out in the sun. Vitamin D is a hormone that our skin produces when it gets the sun rays, and we are trying to hide more and more from it. It is known that a good level of vitamin D improves the fertility, especially in women, and is very important for the good egg quality. Therefore, try going out in the sun for at least 30 minutes every day or at least 4 to 5 times a day so that you do not need any supplements to build up your vitamin D levels later on, and will also keep your bones much healthier. Also, avoid foods that are rich in saturated fatty acids or saturated fats or processed foods. All these foods are very toxic not only for our body but also for our egg quality. And take a diet which is rich in antioxidants, especially the green leafy vegetables, fruits, etc., because they are very good for giving us the nutrients that our body needs to maintain a balance. You should also avoid smoking as well as alcohol, because this has been very well correlated to have adversely affected the fertility in both men as well as in women. So quit smoking and keep your alcohol intake in check so that it is not going to have a long-term impact on your fertility. Also be very cautious about multiple sexual partners. It should not be any sexual activity with any sexual partner should not be undertaken without proper precautions. So wherever you are indulging in sexual practices, be sure that there is no risk of a sexually transmitted infection because you did not take adequate precautions. If we are able to take care of these certain aspects in our lifestyle, probably our fertility will remain much better, and therefore you will be able to get pregnant faster when you are ready to have a baby.